leaders and county assemblies for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor as your servants, whom you've been pleased to call to the performance of important trust in this county. Let your blessings descend us upon us here assembled, and grant that we treat and consider all matters that shall come under our deliberation in so just and faithful a manner to promote your honor and glory, and to advance the peace, prosperity, and welfare of our county and of those whose interests you committed to our church. Amen. Kindly take us through the order of the day.
Order paper number 167 of today, Wednesday, 3rd April 2024 at 2:30 p.m. Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
Honorable members, I want to make communication based on observing that I observed in the morning session. There were a group of public who came to this assembly when the session was going on. I want to apologize on behalf of the staff, but I've made it clear, even in the morning session, that it is an offense based on the Powers and Privileges Act for any member of the public to access the precincts of the assembly without authority. That was breach of both protocol and even the immunity that the members of assembly enjoys. Reason being, it entails even the security of the members. I have communicated to the clerk and cautioned that a report on what transpired be prepared for further action on the same. You please refer to the Speaker's rules on how you allow your visitors or the members of the public into the presence of the assembly. It is for your own benefit and even the benefit of the whole county assembly. We have to be cognizant of the fact that we must have record of all members coming to the assembly and the visitors and even the public. That is why even in the assembly we do register our presence. So even the public, when they come, there is supposed to be a register so that we know who comes to the precincts. We have always allowed those who are picketing to do so outside the presence of the assembly and not inside. So I apologize on behalf of the staff, but I want to assure you that I've cautioned that a report on what transpired be done and will take necessary action. Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
Next order.
Order number 5, papers.
Honorable Alice, what is it, Honorable the Ajwang?
Thank you, Mr. Speaker. Mr. Speaker, I rise on behalf of Honorable Alice Wajewa. Thank you, Mr. Speaker. Pursuant to the provision of the order number 1826, read together with the order number 217/2 of the standing order, I wish to table today, Wednesday, 3rd April 2024, a report of the Trade, Tourism, Industry and Market Committee on the petition against a large rogue leadership of Kibuye Market Management Committee led by Mrs. Judith Adhiambo Matengo.
Members, I want to confirm that the Committee on Trade, Tourism, Marketing and Industry report on the petition on the alleged rogue leadership of the Kibuye Market Management Committee led by Mrs. Judith Adhiambo Matengo is properly laid before the House. And I want to refer ourselves to standing order number 217 on petitions. That every petition presented or reported to pursuant to this part shall stand committed to the relevant central committee. And whenever a petition is committed to a central committee, the committee shall not more than 60 calendar days work from the time of reading the prayer respond to the petitioner by way of a report addressed to the petitioner or petitioners and laid on the table of the county assembly, and no debate or in relation to the report shall be allowed. But the speaker may, in exceptional circumstances, allow comments or observations in relation to the petition for not more than 20 minutes. The clerk shall, within 15 days of the decision of the county assembly, in writing notify the petitioner or the petitioners of the decision of the county assembly on the petition. Honorable members, the petition at hand is a petition by Kibuye traders against alleged rogue leadership of Kibuye Management Committee led by Honorable Judith Adhiambo Matengo. And during this house sitting on the Thursday, 28th September 2023, I reported to this House a petition dated 10th July 2023 by Kibuye traders against alleged rogue leadership of Kibuye Management Committee led by Judith Adhiambo Matengo. The petition alleged the following. Number one, that public participation was not undertaken for the election as enshrined in the Constitution of Kenya 2010, and that election, that is number two, that the election violated Chapter 4 of the Constitution on Bills of Rights, especially Clause 1A of Article 33 of the Constitution. Number three, that removal of goons or hooligans assembled in the market in the form of security and the market cells be dismantled. Number four, that the rogue leadership of Judith Matengo be investigated. 5, delegalizing extortion fee / security levy. And 6, immediate restoration of abolition block to sectoral traders. 7, the terms and conditions of the alleged market management committee and organization of fresh elections. The petition was thereafter committed to the County Assembly Committee on Trade, Tourism, Industry and Marketing for consideration in accordance with the provision of Standing Order number 217-2 of the Kisumu County Assembly Standing Orders. Honorable members, the committee concluded its investigation on the matter, and today the report is laid on the table of the County Assembly. for each issue as follows. Number one, on the issue of public participation not being undertaken for the elections. The fact that all traders exercise their voting rights by electing their sectoral heads as is their I repeat, the fact that all traders exercise their voting rights by electing their sectoral heads as is their mandate indicates that public participation in the election was done, and the committee recommends that market management elections be conducted in strict adherence to the laid down guidelines. And therefore, that prayer was thrown away. Number two, issue of removal of goons and hooligans assembled in the market in form of security. The committee finds Mrs. Matengo in contravention of Article 73 of the Constitution of Kenya 2010. And the recommendation is that the committee recommends abolishing the use of private security or traders by the alleged market management committee for nighttime security. The new market management committee that will assume office after fresh election should take steps to prevent individuals who harass or endanger traders from operating within the market. The practice of using power houses as a makeshift detention cells for traders must cease immediately. On the issue of rogue leadership of Judith Matengo, based on witness testimonies, police reports, and traders' submissions, the committee finds Ms. Judith Matengo and the Market Management Committee in contravention of the provisions of Article 73 of the Constitution of Kenya and Section 63 of the Penal Code, CAP. And the recommendation is that the committee recommends that Ms. Matengo ceases all actions that reflects harassment of traders, damage of traders, merchandise, and infringing on their right to free expression. On issue number 4, on delegalizing extortion fee and security levy, the committee acknowledges the initial agreement among traders for daily security levy of 10 Kenya shillings. And the recommendation is that the new market management committee, in collaboration with traders, re-evaluate the levy, decide on revised terms or abolish it altogether. On issue number 5, issue on immediate restoration of abolition block to several traders, the committee established that there are 8 abolition blocks in the market that were handed over by the city of Kisumu to the Market Management Committee, herein under investigation for the management through an MOU. The committee recommends that each sector make a formal request to the relevant authority for management of the abolition blocks for consideration. On the issue of terms and conditions of the alleged management committee and organization of fresh elections, the committee established that the current management committee under investigation has run its 3-year tenure. And the committee recommends for new election to commence forthwith for a new market management committee. This election should be conducted in strict adherence to established regulations or guidelines as outlined in the Market Act Cap 482 of the laws of Kenya or any other relevant county market regulations. Honorable members, the committee has further made the following general recommendations. 1, that the city board is directed to develop and implement proper legislation for managing all markets within Kisumu County by end of 2024. And this regulation should establish effective management systems to ensure the smooth operation of these markets. Number 2, that since there exists a county revenue board legally established and mandated to streamline revenue collection, the committee recommends that revenue board to assume its responsibility for all revenue collection previously handled by the Market Management Committee forthwith, and if need be, a new memorandum of understanding may be established to ensure the Market Management Committee retains the responsibility for operating, maintaining, and managing the abolition blocks. The responsible department within the city administration will provide necessary facilitation for this purpose. And number 3, that the city of Kisumu is urged to prioritize the safety of traders and their merchandise. This includes ensuring adequate security presence during both day and night time by contracting security firms, and if possible, liaise with the Directorate of Inspectorate for establishment of a dedicated police post within the market. Use of personal to private security, including goods and traders, are thereby prohibited. Number 4, that the operations of the existing market management committee be suspended with immediate effect by the city manager through a notice. An election for the market management committee shall be conducted on a date not later than 30th August 2024 with the full representation and participation of all the traders in the market. And 5, that the Constitution of Kenya 2010 empowers various institutions to address contraventions of law, and any person found in the contravention is liable for legal action, disqualification from office, or upholding of fundamental rights. Having found Mrs. Matengo and currently Market Management Committee in contravention of the laws regulating conduct of office bearers and the provisions of Chapter 6 and Article 73 of the Constitution of Kenya 2010, the committee therefore resolves as follows: that the city manager to immediately suspend the operations of the existing Market Management Committee through an official notice. A fresh election for a new Market Management Committee be conducted by not later than 30th August 2024. This election must ensure full representation and participation by all market traders. The following listed persons are not eligible to vie for any position within the market. Ms. Judith Matengo, Alice Waga, James Odiwuor, Peter Otieno, Molly Otieno, Daniel Okumu, Jack Awandu, Austin Tom, Marion Akinyi, Lynette Onyango, Fidel Opala, Eric Otieno, Saum Rashid, Kennedy Anditi, Barnabas Oko, Beatrice Ouko, Ruben Omumbo, Oko Charles, David Okambo, Jared Onyango, and Walter Aol. Honorable members, Standing Order number 217.2 states that once a petition is committed to a committee, the committee works on it and gives the response to the petitioner by way of report addressed to the petitioner or petitioners and laid with the table of county assembly. And as I had indicated, there shall be no debate in relation to the same. But the speaker may, in executive circumstances, allow comments or observation in relation to the petition for not more than 20 minutes. Honorable members, I want to allow the same, that in the next 20 minutes, for those who have comments on what I have presented based on the petition, it's a summary of the petition, can give their comment. Honorable Whip, Honorable Seth Kanga.
Thank you, Mr. Speaker. Mr. Speaker, I want to register my comments on the petition and on the recommendations of the committee based first on the law. Because, Mr. Speaker, the residents of Kisumu or any citizen has got the right
Does proceed? Sorry for that.
Has got the right to petition the assembly in any circumstance when they are dissatisfied with the services or any administrative action of the county. However, the law must be followed at all circumstances. Mr. Speaker, you have read that the lady Judith Matengo has been subjected under Article 73 of the Constitution, Mr. Speaker. However, she may have committed some issues at Kibuye Market. Article 73 that does not apply to the person of Judith Matengo. Article 73 talks about state officers. And state officers in this case are the president, the deputy president, the senators, members of parliament, women reps, and finally the members of the county assembly. And if you talk about Article 73, it goes further to talk about Article 74, where they are subjected to oaths of office. Did Nyaramba take any oath of office? Subject to Article 73, where you are vilifying the same lady. These are the reasons why we fail when these matters go to court for judicial review. Because the baseline is that we are subjecting the lady Judith Matengo to Article 73 of the Constitution, while she is not a state officer. That is null ab initio. Another issue I want to talk about is condemning the said people whom their names have been mentioned, not to contest in further market management committee meetings. I don't believe that if the assembly has the powers to stop one from contesting in any election, that one we are violating the Article 1 of the Constitution, which talks about sovereignty of the people of Kibuye Market or Kenyans at large. When you have the powers to tell the people that so and so cannot contest, then the assembly, I think, has gone ultra-vires. Another issue, if you look at the verdict, these gentlemen were not subjected to Article 47, whereby we have not seen the annexes in the reports where they were notified of what they were accused for as traders of Kibuye Market, given time, how they responded, and the proceedings of that committee meetings are not attached to this report which we are seeing here. How they responded. You cannot condemn people. I am always a visitor of courts, whereby I attend courts to attend to criminal matters and civil matters. When you are condemned under Article 47 of the Constitution, it must be fair and procedural, whereby you are notified of what you have done and you are tried fairly. In any case, the assembly could have invited the said persons together with the advocates, because the assembly had gone further to enter into the rights of those people, the right to contest, their democratic right. They have been denied their democratic right, which is enshrined in the 2010 Constitution, just because of hearsay rumors which are not captured. So, Mr. Speaker, if we want to proceed, we should proceed in a fair manner and citing laws which are relevant to what we are talking about. Because I've cited Article 73. The lady Nyaramba is not a state officer, Mr. Speaker. Let's be fair. Unless you want this matter to fail, she will go to court and ask the courts if she's a state officer under Article 73. Otherwise, Mr. Speaker, I rest my case, but the report is good but the articles, the authorities cited in the report are wrong, and we are going to fail. Otherwise, thank you, Mr. Speaker.
Honorable Kelvin.
Mr. Speaker, I want to thank you, Mr. Speaker. I want to thank the committee chaired by Honorable Alice Wajua for doing their work and reporting on time. From what you just read, Mr. Speaker, you are talking about a report by petition coming 60 days, not later than 60 days. By the time the investigation started up to date, it is more than 60 days, Mr. Speaker, and to me, the report is null and void. Mr. Speaker, I want to share or agree with the whip on what he has just said. I don't know who was writing the report, but in matters of must be to the point. You don't just quote an article 3, article, without even pointing that this is the section you are referring to. And remember, assembly is not the last where somebody can get justice. Furthermore, assembly up by denying people rights, Mr. Speaker. So in that report issue where Judith Matengo is named as one of the person bringing problem in Kibuye market. And the complainant with that statement you are reading shows that these two teams, those who lose the election will always complain. And they've realized that assembly is where they can get some advantage so that they can quash an election done in the market. It will be so malicious, Mr. Speaker, to let Assembly of Kisumu start solving problems of market and trying to solve problem of election saying it's no any letter, minutes or any invitation of that I'm doing this because of this and that, and we are not agreeing with the election or something like whatever that was being portrayed. We are just given a copy of a report, and if you look at the report itself, the committees or the members who signed the report, in my on the issue of election that is being purported that it was not done well, I think we don't have any law, which I agree with the petitioner, with the report. We don't have any law that give guidance on how election of a market can be done. Remember, in Schedule 4 of the Constitution of Kenya, market is squarely under the county government, and it is late. The CC in charge of trade by now should have come up with a law or a legislation that can protect and can give direction or procedure or even guidelines on how to elect market leaders or traders leaders and how they can vacate office. So that is a mistake on the CC or the department in charge. The report talks about the city board making that, and the city board trying to look for the entire county, which actually is wrong. The city board is only mandated to work within the jurisdiction, that is the city area. But the report is trying to talk about they come up with a legislation that can help the entire county. That actually, I don't agree with the report. Mr. Speaker, there's that point mentioned about fair administrative action, Article 47, where any person accused in Kenya must always be given time to defend himself or herself. You cannot just wake up and write names of people without giving them fair hearing. And assembly cannot be used to pass a law that at the end of the day will question some of those issues. And here we are seated, people with honorable titles, that we could not foresee that and even reject the report because of such anomalies, Mr. Speaker. Finally, Mr. Speaker.
On a point of order, Honorable Speaker.
What is the point of order, Honorable Seth?
Thank you, Honorable Speaker. Maybe on statement of facts. I can see on the same report that the Honorable Member is referring to, and the same that the whip has also made his submission. I can see it's written that the petitioners appeared before the committee on 19th October 2023, and then on the same report on 23rd of October 2023, the committee met Kibuye Management Committee. Honorable Speaker, are we referring to the same report or they are reading a different report, Honorable Speaker? I need your guidance. Thank you.
Honorable Kelvin?
Point of information, Mr. Speaker. I want to inform the House at the same time the Honorable Setoku.
What is it?
Mr. Speaker, when the Assembly or a committee of the House makes such recommendations, did the members appear in the committee and did they take oath? Because we are making far-fetched recommendations. Did the said persons took oath or take oath as per the laid down procedures? If they did not take oath, Mr. Speaker, while they were giving their evidence or defending themselves, the act is an act of nullity, Mr. Speaker, because they did not take oath, and we are about to make recommendations touching on matters which are going to stop even the persons from contesting in the subsequent elections, Mr. Speaker, which according to the report will be held in August, and they did not take oath of office. And we are about to make recommendations that they are not supposed to take. But if there are evidences, Mr. Speaker, where are the annexes, how they testified, how they defended themselves, that is not attached to the report. Thank you, Mr. Chief Speaker.
What is the information that you are giving? Honorable Kelvin.
Annexes of how the proceedings were conducted is not included in this report.
Do you have the report with you?
I have the report, the soft copy.
Honorable Seth Kanga, I have the full report with me here. What I gave is a summary of the petition on what I've read here, to give an opportunity for the members who want to comment. And I did read standing order number 217 on what happens when we have a petition. I also did indicate that 15 days from this from the tabling of this report, we shall make communication to the petitioners, and they also have room to appeal the same. So I want to rule you out of order because the report that we're discussing is a summary of what I only touched on, the prayers and the recommendations. In 20 minutes times, I was not able to go through all the activities that happened in the committees and such like, but I did agree as per the standing order 217-2 that in 20 minutes, for those who have comments, can give a comment. We still have 15 days before we make any communication to the petitioners. Honorable Kelvin, you are.
Mr. Speaker, I was summarizing, and I like the way Honorable Seth Okumi is putting it. And the committee met the new market on what grounds? What was the reason for the meeting? Was it about someone to come and defend? Did you give Judith Batengo time to defend? Did you give the list of Peter Otieno, Molio Atieno? Do we have something showing that they defended themselves on any accusation? You cannot accuse the entire team. Mr. Speaker, you know very well that Article 47 is trying to say that each and every individual has a right to defend himself. But when you talk about a team meeting a team, then that one was omitted. So my prayer, Mr. Speaker, this report is malicious. Its real intention was to target some members of that Kibuye market, and I'm urging the House to throw this report, Mr. Speaker. Thank you, Mr. Speaker.
Honorable Gadolema.
Thank you, Mr. Speaker. Mr. Speaker, I also want to contribute on the same. And I want to believe, Mr. Speaker, any petition to this House is for the whole House. It's not even for the committee. It's just that the committee take the lead and gives a report. But the report, before the petitioner is served or given the petition back, the House has to approve that report and we have to give our recommendations. Mr. Speaker, we cannot let this House of 47 honorable members be misled by 600 people, 600 members. Mr. Speaker, if you look at the report, from the word introduction to the end is malicious. Mr. Speaker, you cannot tell me that today we are sitting in this House to adjudicate on illegal or non-formal entities. What the county government of Kisumu know is that there is Kibuye market with a market master employed by the county government and the revenues officers employed by the county government. Any other thing there is informal. We cannot be sitting here to discuss women group issues. How you form women groups in Boch location. How you form them in Nyaera. Then you bring a petition here so that we discuss informal. Do we even have the constitution? Do we even have a constitution guiding the operations?
What is the point of order, Honorable Seth?
Honorable Speaker, I think I know that what we are discussing in this House today was in the order papers, and it's on a petition that was brought before this assembly. Is it right for the Honorable Gadolema to say that our discussion is based on a women group when the order paper states clearly what we are supposed to be discussing? I need your guidance, Honorable Speaker.
Honorable Gad.
Thank you, Mr. Speaker. I think it's a matter of English that Honorable Seth is not getting me. I'm saying what you're talking about in Kibuye is an informal group. There might be one in Chichwa, there might be one in railways, there might be one everywhere. Do we even have the constitution of that group you're talking about here? Do you even know how they form their membership? How do they register to be part of membership in Kibuye market? Do you even know? Somebody now writes that so and so should not contest any elections. Can you even confirm to us that that person is a registered member in that group? Or that person has a shop or a stall in Kibuye market? Do you have the license of those individuals? So you say so and so is trading in this and should not contest because of ABCD. Mr. Speaker, let's not ruin this House with the irregularities and malicious intentions. I want to believe that when people sit in Kibuye, they sit for their own welfare. And if they cannot make their own welfare run, the county government will run. Let Judith Matengo have a group and continue. The other group, let them follow their own channel and have their groups. That is nothing to do with Kisumu County government. Ours is to get revenue, to give services, and to make sure that the market works. But in anything that somebody is collecting money, if somebody, like now the committee is reporting that some guys are collecting money from traders, that is the work of the market master. What did the market master say to this committee? Do you even have a report of our own employed by the county government in Kibuye that say that have been denied to collect revenue from Kibuye because there are some illegal people collecting the same? Mr. Speaker, we cannot allow this House to release such a report to the public for consumption. Mr. Speaker, if you look at what we are doing today, what we are saying today, I've had Honorable Seth ask whether we are reading the same report. Mr. Speaker, I want to say that from our end, as members who you've given a chance to contribute on this thing, you've infringed on our rights by giving us an unfinished report. What we have here is 7 pages. What you have there is almost 30 pages. And you want us to contribute effectively to what we don't have. Mr. Speaker, I think that order is my yes.
Order. I want you to rule you out of order on that statement. I have referred you to standing order number 217, part 2. And before I gave you time to comment, I did not tell you to debate. I gave you time to comment. And I think the other honorable members are given their comments. It is the comment on a report that has been brought here, and I did my best to give a summary of the prayers and what they have recommended. The reason why I'm giving you time to comment is so that I can make a considered opinion on what we have. It is my responsibility as the Speaker that when there is a petition, I commit it to the right committee as per the standing order, not as per my mind, as per the standing order. So I want to rule you out of order on calling the chair being malicious, and you need to apologize.
Thank you, Mr. Speaker. I apologize, but reinforce that you've given us an incomplete report to talk about. Lastly,
Honorable God, the report is not from the chair. The report is from a committee. So you apologize and proceed with your comments.
Thank you, Mr. Speaker. I know you know very well I don't belong to that committee. So I couldn't get it anywhere apart from through your office. But if that is so, we still agree. But what I want to urge our members in this house today, that Mr. Speaker and honorable members, please let's not play children jokes in this honorable house. What we have before us is a very serious matter. You saw even what happened here in the morning. If the assembly can be stormed to the door because some people want to play politics. Mr. Speaker, this issue is not as light as some people think. If there are people who want to square their own issues outside there, they do it in a better way, but not through our names, through our honorable members, that we are going to pass or give a petition that cannot even withstand a magistrate clerk's office. That petition taken outside here cannot even go through a clerk in the magistrate office to be administered as a case. Mr. Speaker, if the members want us to discuss that issue, I think we were given the Committee of General Oversight. You can recommit that thing to General Oversight Committee where I belong, so that we can check on it thoroughly, get the facts, and make sure that we call all the members of Kibuye with their licenses given by the Kisumu County, so that we know who they are, because there are cartels who are now running this thing in the name of Kibuye is being misused. Mr. Speaker, I want to say we dismiss that report, recommit the report, write to the petitioner, tell him we are going to redo the report, then we do full investigation, but first and foremost, we must know who are we dealing with. Is this a formal group? Is this an informal group? We must get the documentation first. So that when we are dealing with it, we must know who we are dealing with and what we want them to do on our behalf. Lastly, Mr. Speaker, as we do all these things, today, Kisumu County Government, and through the County Revenue Officer, Sub-County Revenue Officer, and the Market Masters of Kibuye Market must appear so that we all know the challenges the county government is facing before we know what the challenges the traders are facing before us making this report. Mr. Speaker, I appeared in one of the meetings when the petitioners were here. No single document, no single evidence to show that so and so has done this. They were all rumors, they were innuendos, and they cannot be administered even in this table clerk office. Mr. Speaker, I want to urge our members that we dismiss that report. We commit the report again to the General Oversight Committee. We do a thorough thing and give guidance to the traders in Kibuye. Thank you.
I had directed that this is not a debate. Actually, what I needed is a comment on the petition, not even on the report. Comment on the, please, honorable members, we need to refer to our standing orders very well. It's a comment on the petition, not on the report.
Point of order, Mr. Speaker.
So, denied Honorable Seth Kanga.
Mr. Speaker, we cannot comment on, we must comment on something which
Honorable
is
Seth Kanga, receive your seat.
Mr. Speaker,
Honorable Seth Kanga, you are being disorderly. Resume your seat. Honorable Seth Kanga, resume your seat. Order, Honorable Seth Kanga, resume your seat. Honorable Seth Kanga, resume your seat. Honorable Seth Kanga, resume your seat. You are becoming disorderly. Honorable Sepkanga, resume your seat, honorable members. Honorable Sepkanga, you know the rules of debate. If you're on a point of order, you say the point of order. Honorable Sepkanga, you are a leader in this house. You're not supposed to be disorderly. Honorable Sepkanga, I'm being very impartial. That's why I'm giving the honorable members to comment on the report. Otherwise, I would have passed the section. I want to give direction that the members who are standing, I want to give you 1 minute each. 1 minute each. That is 10 minutes. So I start by Honorable Nerea, Honorable Deputy Speaker. Strictly 1 minute.
Thank you, Honorable Speaker. Honorable Speaker, on this matter, Honorable Speaker, we've only access to a summarized version of the petition. But Mr. Speaker, I want to refer ourselves, basing on the sentiments of the speakers that have left the floor, that I want to refer us to section 16 of our County Assembly's Powers and Privileges Act. And Mr. Speaker, allow me quote that any opinion or a committee or any conduct intended or likely to reflect adversely on the dignity or integrity of a county assembly or of members, or to be contrary to the best interest of a county assembly, is referred to as by this section as a breach of privilege. Mr. Speaker, I don't want to refer to this house as a house that lacks vision in terms of consideration of petitions, Mr. Speaker. There are members of this committee who sat and did the report. And Mr. Speaker, maybe due to lack of time, but they would have given us more insight on what occurred or how the petitioners presented themselves. Because, Mr. Speaker, at this level, we are not in a position to examine every detail of the report, because that full report has not been provided for. But quoting the standing order upon which you've allowed us to share our views, Mr. Speaker, it does not require that we debate, and therefore we want to excuse them for not providing a full report, Mr. Speaker. So, Mr. Speaker, any sentiments thereof that are meant to demean the dignity of this House, Mr. Speaker, I want to say are a breach of privilege. Thank you, Mr. Speaker.
Honorable Leader of Majority.
Thank you, Mr. Speaker. The Speaker, I also rise to make my brief comments. One, Mr. Speaker, I want to be on record that anytime there is an emotive matter from this committee, the chair is always absent. And I think that is a very important observation. So, Speaker, we are from a training, and we were advised that in the absence of the chair should have given written permission to the vice chair to read on her his behalf. I hope she did so. Otherwise, Mr. Speaker, I want to agree with the findings that public participation is very important for members of this market to have participated as enshrined in 2010 Constitution. Mr. Speaker, this is a matter that has divided the market into two. That as an assembly, we must be very careful and provide proper solution. On the issue of the goons and hooligans, I think that is a matter that should be addressed by the city and the county government, because we have county enforcement officers that should provide security in the markets. Mr. Speaker, on the issue of the pollution block, I also agree that they should be reverted to the sectoral committees and urge the county revenue committee to take over the collection of revenue from these blocks. Lastly, Mr. Speaker, I've gone through the report and I also confirm that what you've read is the true version that was posted in our groups. Mr. Speaker, the cases that were mentioned that are at police OBs, I think the cases do not border on any criminality against these individuals that can stop them from vying. After all, this is a market committee that has its own constitution. If the constitution allows them to, that there is no term limit, then we should not, as an assembly, stop these members from vying for this position. After all, we will be infringing or denying them their rights as enshrined in our constitution. Thank you, Mr. Speaker.
Ochele?
Thank you, Mr. Speaker, for giving me the time to make my comment. Mr. Speaker, I'm privileged to be a member of this House. That the members of the public have been perceiving us to be one of the best assemblies in this republic. Mr. Speaker, I attended a function where His Excellency Professor Peter Nyang'nyong'o was very much present, and he said all over the republic, there is no assembly with brilliant brains like that of Kisumu County Assembly. And Mr. Speaker, we are the only assembly which is headed by an engineer. And we have several engineers as members and different professionalisms, Mr. Speaker. And therefore, I want to believe that as we make our comments, the comments are coming from very intelligent minds that have done their thorough research, and therefore, the outcome will be something positive for the people of Kibuye and Kisumu County at large. Mr. Speaker, we have the Powers and Privilege Act. And the Powers and Privilege Act gives us boundary within which we can operate. Our mandate in this House is to make law. But Mr. Speaker, we are only allowed to make law, but we are not the interpreters of the same law that we make. And Mr. Speaker, I read some paragraph here which had been referred to by, by the leader of majority, that this person called Judith Adhiambo Matengo, to show respect to the rule of law by obeying OB records like that of Kevin Ouma Miko and that of Beatrice Wamalwa. Mr. Speaker, how does this assembly know that these people or this person does not obey the law? Mr. Speaker, we don't interpret the law in this House. Mr. Speaker, if there's a breach of law outside there, the OB is taken at the police station, Mr. Speaker. The police have powers to arrest anybody who has acted in a manner bordering criminality. And Mr. Speaker, there are courts. Any matter which has gone to the police should not be referred back to this House for interpretation. And therefore, Mr. Speaker, we can also pass this burden to these individuals that they've not respected the OBs, and therefore they do not merit vying as leaders of the market, Mr. Speaker. And Mr. Speaker, I have an authority in this county called Kisumu County Public Service Board. This is the authority tasked with advertising, recruiting, appointing members of staff for the county. Mr. Speaker, market is not exceptional. We have a market manager. We have tax collectors. Those are staff which are directly answerable to the government of Kisumu and by extension, through their bosses, answerable to this House. Mr. Speaker, in this petition, none of these petitioners mentioned where the staff of this county breached any law, where any anomaly has occurred because of breach caused by the staff of this county. But Mr. Speaker, we are discussing people who we don't have direct link to. And Mr. Speaker, if there was something wrong happening at Kibuye, Mr. Speaker, the person who should have brought a petition here is the city manager, CCM trade, chief officer trade, but not petitioners who lost election, but because they want to go back to the same positions in a moribund arrangement, Mr. Speaker, then we are invited to arbitrate. I think we'll be losing it. We'll be losing it big, Mr. Speaker. And therefore, Mr. Speaker, I summarize by saying that I beseech my Speaker, who I know is always wise, return that report to the the sender or the committee, so that they can do proper research on this thing. And Mr. Speaker, when a report of that magnitude is brought before this House, it is just in order, in a simple order, that members are provided by the details, even if you are not to debate, but the details of the petition and their findings should have been provided earlier in advance, Mr. Speaker, 24 hours before debate. And here, Mr. Speaker, we only got the summary. And when we are asking about these annexes, they are not there, Mr. Speaker. So I beseech the chair that we save the face of this House, we save our face in the Kisumu County public, so that whenever we make decisions other than this, Mr. Speaker, then we'll be walking the streets of this town with our shoulders high. Thank you, Mr. Speaker.
Honorable Karen.
Thank you, Honorable Speaker. As you all know, I'm the MCA Kaloleni Shaurimoyo ward. Kibuye Market is in my ward. And I'll start by thanking the Committee on Trade and Tourism for the work they have done. The petitioners and the petitioned are my people. I know all of them. I've been in Kibuye long enough. I've been there as a trader for more than 20 years. And the two parties have all complained to me. As a mother, I thought they did a good thing by bringing the petition here so that they can be given a fair hearing. But I'm surprised that I attended one of the sessions when the petitioners were invited, and even when the management committee was invited here. Department of Trade was also invited here, and they made their submission. And I'm wondering why the report is so narrow. I don't know why the clerk was so mean. They would have included they would have included everything which can make us know what is going on. Even the vice chair of that committee, management committee, was here and he testified. He even testified against the committee. And as that committee is being considered a court, we can call the deputy chair as the prosecution witness. Even his report is not appearing in that report. The committee went to the market to talk with traders to get more evidence. They even talked with the market superintendent, all the officers, county officials responsible in the market, and they gave their submissions. It is not appearing in the report. So whatever we have is so narrow. It is narrowed. You cannot make a good conclusion from it. And I don't know what's happening. And again, all the trade committee members are here and they are not talking. There's nobody coming up to give people a clear picture of what has been going on in that committee. They have even fought concerning the report. Even the papers were told. And yeah, there's a problem in that committee. Even that committee should be investigated first. And we have to know why the chair is not here. There's something going on. So what we are being played with, there's something going on. And I wonder why the committee members are not talking. You need to tell us all the process which was followed and what you encountered in the process. That can give us a clear picture for members to come out. Honorable Speaker, I'm the area MCA. Those are my people, and I need to help them. Even now they are listening as I talk. I'm not supporting any team, but I request the Honorable House, Mr. Speaker, that the committee go back to do a good report with everything, full details. So even if we come here, we are not supposed to be given a summary of the report. What we were given is chair's notes. We are supposed to get a full report so that we make our own notes. Thank you, Honorable Speaker.
Honorable members, I want to close the comments on that petition. Resume your seat, honorable members. Resume your seat. Honorable members, resume your seat. Honorable members, I appreciate your comments on that report. But I want to implore upon the honorable members that please, sometimes we have to understand that we are guided by the rules of this house. And number one guidance is the standing order. I have looked at the standing order severally. And if you look at standing order number 209, part 23, from part 23, it's about public petitions. And there is direct provision on what happens, the meaning of public petition, submission of a petition, notice of intention to give a petition, from standing order number 209 to standing order number 219. So I really find it amusing when members stand to debate, and it's like we are not of any knowledge of the existence of this standing order. Honorable members, I always say that we can revise the standing order as many times as possible, from anywhere, from any member. The standing order provides that any person can bring a petition to this house. Any person can bring a petition to this house. Honorable members, I did present to you when the petition came to this house. I didn't have enough time to present the schedule that I signed for that committee. It is not my responsibility to be in that committee when they are talking to the petitioner or the petitioned. But there is one thing I've noticed in the standing order. It does not envisage a situation where members are of contrary opinion, because it only provides that once a petition has been committed to a committee, the committee do their report. Once they do the report, including public petition, they table to the House. Once they table to the House, we make a communication to the petitioner and the relevant stakeholders who are there. Please read your standing order, it's not the same. It does not envisage a situation where it does not...
Information, Mr. Speaker.
I am on my feet, Honorable God. The standing order does not envisage a situation where there is contrary opinion. So I want to ride on standing order number 1 of the County Assembly standing orders, which gives me authority on matters that are not expressly provided for in the standing order. This matter that we are seeing now is not expressly provided for in the standing order, and therefore I can ride on the standing order number 1 to give a direction. And I give 2 directions. Direction 1, we have got 15 days up to the communication of this petition. I therefore want to urge any member to bring a motion to this House that leads to us rescinding this report. Number 2, on the comments made by the members, I want to direct that I am going to give a considered opinion on the same report before the expiry of the 15 days. If there shall not be any member who has brought a motion rescinding the decision of the committee on the same. And so I direct. Honorable members, I want to recognize the following members in the gallery. We have Amanda Stephen. We have Helen Gush. Director of ECD, Willikista Odera. Dennis Adero. We have got Birungi Catherine, I think all the way from Uganda. We have got Michael Akech. Mikal Akech. We have got Benta Omolo, the ward administrator. Which ward? North Seme ward. The group that I've mentioned is from Play Action International from UK. They are in the country as stakeholders and partners with the county government. And I think Honorable Badega, I noticed Honorable Badega was here. I've been having them round. They are dealing mostly with issues, early child development, education. I want to give Honorable Badega just 1 minute before we go to the next order.
Thank you. Thank you, Honorable Speaker. And I also take this opportunity to welcome my visitors from United Kingdom. Our visitors, this is a house with 47 members, 35 elected, and 12 nominated. Our duty here is oversight, legislation, and representation. Here in Kenya, we have two governments. We have the national government and county government. And here in Kisumu, where there's a county government, we have two organs. One is executive, the other one is assembly. All projects being done down there at the ward level, first the executives are doing the public participation, then it is being brought here by the executive for approval. After approval, we are doing oversight on the ground for all projects. And I take this opportunity to tell my brothers here, my colleagues here, that these are good friends. They have done wonders in my ward. First, Obuolo ECD, they have built a modern ECD, 4 classroom. Yesterday, they were going round to my ward where they are going to build a playground for the ECD kids, Ongadi, Kianja. Today we were in Kisumu North Ward. We were at Osinde ECD. Later we visited the Sidika ECD where they are surveying where they want to do other activities. And right now they are heading to North Seme, where they intend to build a modern classroom at Kanonyongo, ECD, and Rapogi. Thank you very much, members. When you see them, welcome them. They intend even to visit Bwanda in Kolwa Central and other wards. We have a good plan with them. Even the chair can confirm. They intend to build 42 ECDs in Kisumu County. Even the governor is aware. We are planning to sign with them an MOU with them. Thank you, Mr. Speaker. And our visitors feel most welcome in Kisumu. Enjoy fish. Enjoy everything. Thank you very much.
Thank you so much, Honorable Adega. The Chair Education, 1 minute.
Thank you so much, Honorable Speaker. Honorable Speaker, I want to join my colleague in welcoming our guest to the County Assembly of Kisumu. I was with them yesterday when we went to Kianja Primary School, where they are going to do a playground for our ECD kids. This is not the first project they are doing. They've done another one at Obuolo, and like my colleague says, they are planning to do several in this county. We promise to do our part as a county government so that we make this possible. I want to thank the majority leader for retaining members of VCD committee, and you can see all of them are very, very active and bringing people who are going to help us in this county, and they are not specific to their wards. You see Adega is stretching to Sidika, which is in north, in another, what's the other school? Bwanda, which is in Honorable Raro's ward, North Seme, which is Honorable Millis ward. I know they are soon coming to East Seme. And the 42 ECDs will make sure that each and every ward gets a taste of what Play Action International is doing. in this county and in this country and in the world. I know we might soon visit them. Honorable members, we pray that when that time comes, we shall get more goodies to come home with. When they are here, please join them wherever they are. If you have some tea somewhere, you can always invite them so that they see our courtesy and they enjoy our county. Thank you so much, Honorable Speaker. I really welcome our visitors.
Thank you so much, Honorable Seth. Our visitors, you are welcome to Kisumu County Assembly. Feel free to interact with the members at appropriate time. If there is anything, our sergeant at arms will guide you as appropriate. Next order, clerk.
Order number 6, notices of motion.
Next order.
Order number 7, statements.
It is statement time. Next order.
Commencement of business. Order number 8, motion. Adoption of a report of Medical Services, Public Health and Sanitation Committee on the knowledge exchange exercise between the committee, Mulago National Referral Hospital and Uganda Cancer Institute.
Honorable Emily Oginga, what is it?
Thank you. Mr. Speaker, I'd like to move this motion on behalf of my chair, Honorable Vincent Jagongo, who is away.
Proceed. Honorable Chair, you proceed, but I think we agreed that if a chair is not away, I need official communication. But the Speaker has exempted you.
Thank you, Mr. Speaker. Mr. Speaker, today I would like to table the report on the knowledge exchange exercise between the committee, the Mulago Referral Hospital and Uganda Cancer Institute. Mr. Speaker and honorable members, I'm pleased to present this report. Mr. Speaker and honorable members, I wish to present this report detailing the outcomes of the Committee on Medical Services, Public Health and Sanitation visit to Mulago National Hospital and Uganda Cancer Institute, which took place on 17th October 2023 as part of our commitment to fulfilling our mandate and ensuring continued improvement of healthcare system in Kisumu County. By visiting Mulago, the committee's intent was to gain valuable insights into the best practices for managing a large referral hospital. This knowledge is aimed for application at JOTRH and KCRH, among others, ensuring they function efficiently and deliver high quality care. Uganda Cancer Institute is being a leading center for cancer treatment and research in East Africa. The committee settled on it with the intention to leverage on the experience Mr. Speaker, there's so much noise in the house. I don't know whether I should continue with
Honorable
the noise.
Member, Honorable Ngeta, receive your seat. Proceed.
Mr. Speaker, UCI, which is Uganda Cancer Institute, being a leading center for cancer treatment and research in East Africa, the committee settled on it with the intention to leverage on the experience the institution has so far gained in its years of research and cancer treatment for application in the ongoing establishment and its operations to improve healthcare delivery within Kisumu County and potentially the surrounding region. The committee findings. At Mulago National Referral Hospital, Mr. Speaker, serving as a teaching hospital for Makerere University College of Health Sciences, Mulago National Referral Hospital is one of the largest and most prestigious publicly funded hospitals, serving not only Uganda, but also receiving patients from neighboring countries. By a publicly funded hospital, it is intended to mean that services for patients are free. However, this oftentimes is not the case, as there are instances as listed below where patients may be called upon to spend, which is, number one, patients are likely to buy medicine if the ward pharmacy is out of stock of what is needed, and secondly, to pay for ultrasound and lab work. Mr. Speaker, I don't know what's happening in the floor of the House.
All honorable members, Honorable Seth, Honorable Deputy Speaker, Honorable Kennedy Ajwang, please, if you are consulting, consult in low tones.
Thank you, Mr. Speaker. Mr. Speaker, by a publicly funded hospital, it is intended to mean that services for patients are free. However, this often at times is not the case, as there are instances where patients may be called upon to spend. And when they spend, that is when patients are likely to buy medicine if the ward pharmacy is out of stock of what is needed, or to pay for ultrasound and lab work if the doctor requests tests which are not done at the hospital, or in instances that the hospital lab machine is broken down. The role of the facility in Uganda's healthcare system. Mr. Speaker, the committee established that Mulago Referral Hospital plays a pivotal role in Uganda's healthcare system, and it serves as a cornerstone of healthcare delivery in the country, fulfilling several key functions. The first one is a specialized care. The hospital offers specialized medical services, including surgeries, pediatrics, cardiology, and oncology, which are often beyond the capabilities of regional healthcare facilities. The second one is training and research. It is a hub for medical education and research, training healthcare professionals and conducting medical research that advances the field in Uganda. Number 3, referral center. It serves as a referral hospital, receiving patients from lower level healthcare facilities, offering advanced diagnostics and specialized treatment. The key learnings from Mulago National Referral Hospital. The committee learned that the following lessons from MMNRH are that the key learnings from Mulago National Hospitals are that the facility has a well-defined decision-making structure, which ensures that decisions are made in a timely and efficient manner. The hospital has invested heavily in advanced medical equipment and specialized units, which enables it to offer a wide range of specialized medical services. And the hospital places a high emphasis on infection control and sanitation practices to ensure the safety and well-being of patients, staff, and visitors. And lastly, that the fact that the hospital has 10 large washing machines and 1 large industrial iron machine is a good indication of the importance of the facility, that the facility places on cleanliness and hygiene. Mr. Speaker, sir, the committee learned on the best practices that can be applied to Kisumu County, which were identified as follows. Number 1, specialized units. That is, establishing specialized units within healthcare departments is beneficial for offering advanced and specialized care. Number 2, that is the medical equipment and facilities. Kisumu County can learn from Mulago Hospital's investment in state-of-the-art medical equipment and facilities. Adequate diagnostic and treatment equipment, as well as modern operating theaters, are crucial for providing high-quality care. Teaching and research. Training healthcare professionals and conducting research are vital components of healthcare improvement. The 4th one, emergency care. To ensure the availability of well-equipped emergency departments with trained staff to provide immediate care to patients with life-threatening conditions, quick access to emergency care is crucial in saving lives. Number 5 is mental health services. Exemplary mental health services, which is often an underserved area in healthcare. Mental health services should be integrated in the healthcare system. Number 6, infection control. Implement rigorous infection control practices to prevent hospital-acquired infections. That is, proper sterilization of instruments and hand hygiene are crucial for patient safety. Number 7 is waste management. Proper waste management practices, including segregation and disposal of biomedical waste, are essential to maintain a safe and clean healthcare environment. Number 8, energy efficiency and sustainability. Implementing energy efficient practices and exploring sustainability initiatives reduce hospitals' environmental impact. This includes using renewable energy sources and eco-friendly building designs. At Uganda Cancer Institute. Honorable Speaker, this is a summary of UCI's expertise and the key takeaways for the development of the JOTRH Cancer Center. UCI, that is referral to Uganda Cancer Institute, has a mandate that UCI plays a critical role in Uganda's fight against cancer by coordinating policy development, overseeing cancer care research and training, and leading prevention and control and management efforts. The services offered are preventive measures, the screening programs, diagnostic procedures, treatment options, palliative care, cutting-edge research focused on improving cancer prevention, diagnosis, and treatment. The unique funding model. Unlike Mulago National Referral Hospital, whose budget is under the Ministry of Health, UCI has a budgetary autonomy, allowing for a greater flexibility in resource allocation. Honorable Speaker, I think I just need to explain this further because when I first started reading this report, actually I was referring to Mulago National Referral Hospital. But right now we are focusing more on the Uganda Cancer Institute. And if you allowed, we could have actually separated this into two reports because it's more like a two report in one. So now our focus will actually be on Uganda Cancer Institute. So from this funding model, actually you can tell that Mulago National Referral Hospital has a budget on its own as compared to the UCI, which also has its own budgetary autonomy, which allows for greater flexibility in resource allocation. During the tour, there was a pre-tour discussions where the committee and the UCI held a productive boardroom meeting in which they covered various aspects of cancer care, which included the treatment approaches, infrastructure needs for specialized treatment and diagnosis, cancer research initiatives, infrastructure requirements for research labs, data management and collaboration spaces. There was quality control and radiation safety protocols, evaluation radiation therapy infrastructure, patient and staff safety during radiation treatment, importance of patient-centered infrastructure, outreach programs utilizing mobile clinics and telemedicine, consideration for bunker construction. The lessons learned and best practices during this tour are: the committee noted that some aspects in the UCI's operations that thought could offer valuable insights for the Geotriage Center. That is, by adopting these best practices and learning from UCI's experience, the committee is inclined to believe that Geotriage Cancer Center can effectively serve the needs of Kisumu County community. And the best practice models learned were: number one, the comprehensive care model. That is needful to adopt, that there's need to adopt a comprehensive care model, which not only include treatment, but also screening, early detection, prevention and survivorship programs, ensuring a holistic cancer care. The second best practice learned was on community engagement. That is, it is very important to engage the local community. UCI's outreach programs are successful because they involve the community in cancer awareness and screening efforts. The third one is infrastructure planning. It is crucial to prioritize design and layout of the cancer center to create patient-friendly spaces, including comfortable waiting areas, counseling rooms, and support groups. Consideration should be given to the well-lit and soothing treatment areas. Number four is the telemedicine and mobile clinics. UCI understands and has taken into consideration the geographical challenges and thus implemented telemedical infrastructure and mobile clinics to bring cancer care closer to remote areas. Its success is in the areas thus far and can serve as a blueprint. And the fifth best practice is partnership. That it is needful to explore partnership with local and international healthcare providers, NGOs and research institutions to strengthen cancer centers' capabilities. The sixth one is training and capacity building. And in the UCI's approach, there is a continuous training and professional development, which is a very valuable lesson. And the committee grasped that investing in training and capacity building for healthcare professionals is necessary to address the shortage of skilled personnel. The seventh and the last best practice learned was research and innovation. It is important to encourage research and innovation within the cancer center. Supporting local research initiatives and clinical trials can help advance cancer care and improve treatment outcomes. The committee also learned about the challenges faced by UCI. And despite its overwhelming strength, UCI faces a significant challenge, which is the lack of public awareness and misconceptions surrounding cancer, which has oftentimes led to delayed diagnoses. Out of Uganda's 34,000 reported cases, only 20% reach UCI, with children making up 10% of that number. Mr. Speaker, the committee came up with recommendations that in order to identify the most effective strategies to improve healthcare outcomes for the citizen of Kisumu County and the surrounding region, the committee has made its proposals for recommendation in part 2, in 2 parts as seen in pages 28 and 29 of this report. The first part involves the recommendations emanating from the committee's experience and lessons from Mulago National Referral Hospital, a leading medical facility in Uganda, and the committee carefully assessed the expertise and insights offered by the Mulago's medical professionals and made recommendations for their applicability to suit the needs of Kisumu County. The second part of the recommendation focuses on the experiences and lessons from Uganda Cancer Institute, a specialized center dedicated to cancer treatment and research. The committee has proposed recommendations to be implemented to enhance cancer care services within Kisumu County. Acknowledgement. Honorable Speaker, allow me this opportunity to thank all the members and secretariat of the committee for their dedication prior, during, and after this exercise, and in the subsequent production of this report. Equally, the committee recognizes the offices of the Speaker and the Clerk of the County Assembly for offering extreme support and a show of goodwill that culminated to success of these activities. The committee's immense gratitude goes to the management of Mulago National Referral Hospital, led by the Executive Director, Dr. Rosemary Banyima, and her Deputy, Dr. Kabira, Uganda Cancer Institute, led by the Executive Director, Dr. Jackson Orem, and all their staff for the cordial welcome and cooperation according to the committee during the entire exercise. Honorable Speaker, this report has identified areas where the county can make immediate improvements and also long-term strategies for the betterment of our healthcare system. It is therefore my pleasure, on behalf of the committee, to recommend that this House adopts a report of medical services, the Public Health and Sanitation Committee on the knowledge exchange between the committee of Mulago National Referral Hospital and the Uganda Cancer Institute. And Mr. Speaker, I'd like to just maybe just give a brief explanation on this report, because as I read this report actually takes me back to that trip. I know we can't really express what we learned in this document, but I'd like to encourage all the members to get time and go through the whole document, which has pictorial expressions and also details on what we experienced during our tour of Mulago National Referral Hospital. And if only we could actually emulate what goes on at this facility, at JOTRH, or even KCRH, then I think, Mr. Speaker, I think we'll really be doing something for this great county of Kisumu. And also, I would like to request your office, if next time we do benchmarking, maybe if we can actually organize another trip and have the whole house visit that facility, then we'll be able to actually have the same experience and learn the same things we learned during this time. Otherwise, Mr. Speaker, I'd like to call upon Honorable Nerea Kombo to second this report. Thank you.
Thank you, Honorable Speaker, and thank you, the Honorable Deputy Chair Health, for the recognition to second this report. Mr. Speaker, as a member of the committee, I want to say that I was part and parcel of the exchange program, exchange visit, and Mr. Speaker, I also took part in the development of this report. I want to concur and say that indeed the visit to Mulago was quite an experience, Mr. Speaker. I don't want to dwell so much on the recommendation of our report. Much has been emphasized on the best practices that we as a county need to borrow from Mulago to make our facilities better. Mr. Speaker, I just want to emphasize on a few areas that, Mr. Speaker, we also noticed that the hospital had a way of maintaining their facilities and their buildings, and all these other services were contracted, Mr. Speaker, and even the machinery and other equipments were in good shape because individual contractors were given special considerations to offer their expertise. And Mr. Speaker, we noticed that when these services are contracted, then it gives opportunity for the contractors to showcase their worth, and this helps in keeping the facilities and hospital in good shape. As has been said, Mr. Speaker, there was also a garment and linen making section equipped with a fully functioning laundry. Mr. Speaker, this also ensures that the patients always looked neat and clean. We didn't see cases of patients donning torn garments, and I think it is a practice that we also can buy from Mulago to ensure that some of these services are undertaken within our facilities, but given special contracts so that much of it is not sourced from outside. Mr. Speaker, another key thing that we also noticed during our exchange visit was that this hospital offered almost all the drugs that were prescribed. And when we inquired, Mr. Speaker, we found out that the Mulago Hospital does not have a KEMSA version that we have here in Kenya, that the hospital deals directly with the manufacturers. And so it gives very little room for bureaucracies by suppliers, and makes even the prices of the medicine very reasonable. And Mr. Speaker, for this we noticed that some genetical conditions that are very expensive to manage back home here, like sickle cell, are treated for free, and even the medications that are wearing parents with sicklers down. In Uganda, Mulago, it is a matter of just walking to the hospital and picking the medication. And this has made the hospital very popular even with the neighbors, because Mulago does not give barriers in regards to treating the citizens of Uganda and the neighbors, maybe from Uganda, from Congo and Kenya. Once you cross the borders and you go to Mulago Hospital, you will get the same treatment as a citizen of Uganda. And Mr. Speaker, it was a good experience and a very practice worth emulating. And Mr. Speaker, I want to ask this Honorable House to adopt this report, and on the sentiments of the Vice Chair, Mr. Speaker, it is really worth that even the Department of Health be taken for an exchange visit to the same facility to see how they manage to offer curative, palliative, and other preventive health services to their people with so much ease. And Mr. Speaker, with those many remarks, I beg to second.
Honorable members, now that the Committee of Health, the motion adoption of report of medical services, Public Health and Sanitation Committee report on knowledge exchange exercise between the committee and the Bulago National Referral Hospital, which has been moved by the Honorable Vice Chair of the committee, seconded. I want to propose a question, and And I propose that the motion is open for debate. Honorable Seth Okumu.
Thank you so much, Honorable Speaker. Honorable Speaker, being a member of the committee and having gone for the exchange visit, I want to support adoption of this report. Honorable Speaker, they say that sometimes when you don't travel, you might think that your mother is the best cook. Having gone to this exchange visit, Honorable Speaker, it was an eye-opener for me, especially for some of us who sit on the budget committee. I remember in the second assembly, as we were trying to appropriate money for the cancer center, we couldn't really understand because at the time of appropriating, we don't really get to know what it entails to build a cancer center. On this visit, I could clearly see that that cancer center really needed a lot of money. The explanation on that trip was that the walls of the cancer center are almost 4 meters wide, and they have to be done continuously without a stop. That requires a lot of money, a lot of expertise, and a lot of approvals that requires money still, Honorable Speaker. Honorable Speaker, I also remember when JTRH were trying to have a modern kitchen, and we were debating on the essence of having medicine vis-a-vis having a modern kitchen. On this trip, Honorable Speaker, I was made to understand that both are equally important. Patients who are well-fed with nutritious meal and clean recover faster using very little expenditure. Honorable Speaker, I also remember when Dr. Koth was trying to convince members of Health Committee on why they needed a laundry machine for JTRH. That could also help the nearby facilities. Mr. Speaker, by then I wasn't convinced, but this trip made me got convinced that it's necessary to have a well-functioning laundry department to avoid nosocomial infections and other infections that can be caused by laundries used in the hospital that are not well cleaned. So, Honorable Speaker, one, I want to really support the need for exchange visit. I remember in primary school, we used to go to other schools to see what they are doing and learn best practices. Honorable Speaker, sometimes the public feels that it's a waste. But I want to say today that those exchange visits are really important and eye-openers that can help us save a lot of money by learning from other people's experiences. We don't need to sometimes learn from our own. There are so many experiences that people have gone through that we can learn from and copy their best practices and continue with the good that they are doing. So, Honorable Speaker, I rise to support this report, that it be adopted, and we implement the recommendations on the report. But also urge the County Assembly of Kisumu that when it's necessary, please take different committees to different exchange visits. Visits that can add value to the work they are doing and to the service provision to the people of Kisumu County. Honorable Speaker, I support.
Honorable Mildred.
Thank you. Thank you, Mr. Speaker. Mr. Speaker, can you hear me?
It's okay, proceed.
Oh, you can. Okay, from where I'm talking, I can't hear myself. Thank you, Mr. Speaker. I rise to support the report on the Committee on Medical Services, Public Health, and Sanitation. That is a well-written report, and I can see the Committee on Health are now exposed, Mr. Speaker. Many of us lack exposure in our sectoral committees. It's very important to have such a trip and to benchmark with an advanced team that is ahead of us. I remember when the Committee on Infrastructure went to Kakamega, yes, they are very much ahead of us. And when they brought their report here, Mr. Speaker, it was such an elaborate report. And now this is the second report from the Committee on Health. And this shows that now we have two committees now that are now having an exposure. And for Committee on Health, it's an international exposure, Mr. Speaker. You can see a lot of things happening in Mulago Hospital. I first heard of this hospital when I was watching the movie of Rise and Fall of Idi Amin. I think many of you that have watched that movie, you can see that hospital those days when you watch the movie. And when I look at that hospital, it's one hospital which has very advanced departments. The Department of Cancer and many other departments. You can look at their facilities like housekeeping, so advanced. And many times, Mr. Speaker, when the committees go out, I would have wished that we go out with the executive, the department in charge of health, if they could have carried the team from the Department of Health, the CEC and the chief officer and the director. Because when it comes to budgeting, Mr. Speaker, when they bring their budget for the year, it would be in order if they bring in that they would want to buy a machine. Now, coming from an international exposure, it would be so easy to convince members. So, Mr. Speaker, I would wish that the remaining 8 committees would also go for such an international trip so that they also get more exposed, and that would help these committees going forward. Thank you, Mr. Speaker. I support the committee.
Honorable Ratib.
Thank you, Mr. Speaker. Mr. Speaker, I want to start from the tail end. Mr. Speaker, the exchange exercise that is being mentioned here is very important. Very, very important. We get a lot of insights and information that if are implemented in our county, then I think the service delivery in this county will be a good one. Mr. Speaker, one thing that sometimes perturbs me is that reports come to the assembly, very good reports, like the one that has been just read in the floor of this house today. But the implementation status of this report sometimes hit a snag. I hope as a member of the implementation committee, and I see my chair is also here, these reports, if followed to the latter, Mr. Speaker, we are going to have the best service delivery to the people of Kisumu County. Mr. Speaker, Mr. Speaker, I don't know what's wrong with the Honorable Sethu Kumu. Mr. Speaker, I want to compare the Mulago Hospital report that has been read here with what we have here in Kisumu. Mr. Speaker, it is a pathetic situation. You look at our health centers in Kisumu, you compare to the exercise that this team has brought, there is a very big disparity. Mr. Speaker and honorable members, we have to agree that health plays a very important role in our society. Mr. Speaker, we realize that our health centers, patients hardly get the best services. The only service that they get from our health centers is called the consultation. The consultation. Other services are rarely found in our hospitals. This is why people have resorted to over-the-counter whereby patients decide to visit pharmacies and buy drugs without getting proper diagnosis. Mr. Speaker, this is a pathetic situation that the department should look into and see how we can provide drugs and some other services in our health center. And Mr. Speaker, this is very evident, and you can see that is why private hospitals in Kenya are doing better, are making a kill, doing business at the expense of people's life. Mr. Speaker, one thing that I also want to mention is that when we look at our budget, it is always mentioned that the health department give a lot of own source revenue as compared to any other department in this county. What does it mean? Sincerely speaking, it means that this county taxes the dead and the sick more than the healthy and the living. This is a situation that should not continue in this county. We are proud that health sector, the health department, is giving the highest own source revenue as compared to some other departments. Mr. Speaker, this should be looked into. Mr. Speaker, the training exercises that are done in this hospital and the research are also a blessing to that country. And I believe we are also trying to do better, but we cannot be compared to Mulago Hospital. We also have our researchers and the training centers, but at the end of the day, the end result that is needed, service delivery, the health service care to the people, it's still not attained. They talked about robust mental health care, which is important. But if you look at our county, little is given to mental issues. Mr. Speaker, I support the recommendation, I support the report. I believe that moving forward, the implementation committee will take note and we become a county that doesn't task the sick and the dead more than the living and the healthy. Thank you, Mr. Speaker.
Honorable Henrietta.
Thank you, Mr. Speaker. Mr. Speaker, before I give my comments on Emily Oginga's report or my comments, committee on health, let me just answer or give a comment on Mheshimiwa Boyton. I think not everything else is implementation. I think there are parts of the implementation that has been done in this country. Mr. Speaker, we have a Beyond Zero campaign which was done by Mrs. Margaret Kenyatta. Where are the mobile clinics? Were they not implemented? They were implemented, and where are they today? They are lying in parking areas or parking lots. So there are areas in this country that if we don't look at them carefully, we can implement as a committee. But if we don't do a follow-up as a legislative arm of the government, then everything is still going to fail. I think it is a matter of integrity. If we do not consider that as part of implementation, because we will just implement and leave it there. So we are supposed to take it from there forward. And I've just given one example of Beyond Zero campaign mobile clinics. And I think we have them. Are they working? They are not. So spare me some time. I will give you no member.
On a point of order, Honorable Speaker.
You always
What is the point of order?
No one.
Order, Honorable Henrietta.
Mr. Speaker, let me just this member.
There is a member on a point of order, Honorable Henrietta. You will get.
Honorable Speaker, the lady on the floor, the Honorable Henrietta, is the chair of implementation. And the implementation that she chairs looks into the implementation of the resolutions of this House. And the Honorable Chair is telling the House that some of our resolutions are like Beyond Zero campaign that is not implementable. And Chair, that is what we want her to do, to follow up on our resolutions and bring report back to this House that whatever we resolved could not be implemented, giving us reasons. So, Honorable Chair, I think it's not right for her to continue by saying that she cannot follow up and she's the chair of implementation. Thank you, Chief.
Honorable Henrietta.
Mr. Speaker, sir, that was just an example. That even though, of course I'm going to implement some of these things, and you are not going to find it easy, because I'm going to do it. You and the CECs of this county government, you are not going to find it easy, because I'm going to do it.
Point of order, Mr. Speaker.
Mr. Speaker, just give me time, I talk.
Point of order, Mr. Speaker.
What is the point of order?
Mr. Speaker, I'm just seeking clarification on statement of facts. I just want to know elaborately from the honorable member on the floor what she means by that she is going to implement, and we are going to see that you and the executive. So, Mr. Speaker, who is you in this case? Thank you.
Honorable Henrietta.
Mr. Speaker, the reason why I'm talking like this is because none of these members stands up and no talk about implementation. I think implementation.
Mr. Speaker.
Mr. Speaker. Again, because I'm going to do it.
Point of information.
Honorable Sami, whom do you want to inform?
I want to inform honorable member on the floor.
Honorable Henrietta, do you want to be informed by Honorable Sami? Receive the seat, Honorable Sami. Honorable Henrietta, proceed.
Mr. Speaker and honorable members of this county assembly, I'm telling you that this implementation issue, we are going to deal with it. Let's come, because I cannot do all of them now. I know we have a lot of work, but believe me or not, we are going to do it to the latter. Because, Mr. Speaker, thank you very much. This training you took us to has really opened my eyes. I think before I didn't know what to do. I was lost somewhere. And I was like, how am I going to do all this? But because you told us that you need to go for this training and you are going to come back a better person, I think I've come back a better person. And I'm going to implement these things to the latter. So I don't want...
Point of information, Chair, Speaker.
Whom do you want to inform?
The House.
What is it?
Thank you, Mr. Speaker. I want to inform the House that the work of the committee is to follow, not to implement. The work to implement is executive, but I know the member is still learning.
Mr. Speaker, then we need to erase that word implementation. Then we insert what Honorable Sami has just said. We need to call it a follow-up, a follow-up committee. Mr. Speaker, I was just informing my friend Boyton, and I think I'm done with my information. So I want to congratulate the Committee for Health. And one of the issues that has really touched my heart is that health is actually one of the serious business in this country. And even if we try to implement these things, I've just given an example of Beyond Zero, mobile clinics. they are lying idle. In Mulago, they also have such. They also have waste management. I don't think we cannot do these things in Kenya. And I think some of them we have done. The ones we have done, are they still in the state at which they are supposed to be or not? So sometimes we implement, but after implementing, what happens after that? So I don't think Uganda is better than Kenya. I don't think so. But I think there is something that is within us that cannot allow us to do things the way they're supposed to be done. We can do waste management. We can do the laundry, as she read. We can do all those things. We can even do cancer. Yes, it's a very good hospital. But do you think we cannot do those things in that hospital? It is a teaching and referral hospital. So what is there that Deputy Chair Health has read that we cannot do as a country? We can do them as a country. It's only that we lack integrity. So we have to look at ways and means of planting that within us, so that when we want to do something, we do them. And when we don't want to do them, we don't even talk about them. Thank you, Mr. Speaker.
Honorable Ken Ouko.
Thank you, Mr. Speaker. Thank you for giving me this opportunity to express concern on the report by the Health Committee. It is important, Mr. Speaker, that we do a comparative analysis on maybe Jaramogi and Mulago Hospital. And what actually perturbed me is the situation which actually happened in Uganda. Uganda was in civil war for some time while Kenya was developing. How comes now we can benchmark with Uganda? It means there must be something which did not go on well with us. We have to change the attitude. It is very important that when we change the attitude of our workers and even the citizens themselves, we will have to move. If we don't do that, even if we have the best facilities, best hospitals, best doctors, we will not move. That is the first thing we should do. I did not hear about corruption, which is so rampant in Kenya. I did not hear what they talked about when they were in Kampala. I wanted to hear where there is some corruption there. But at times, we must have to blame ourselves. There is what we call facility improvement regulation fund, which is actually in place. It has some bottleneck clause, which is preventing the hospital from buying directly from the pharmaceutical companies. You have to send back money to the department. They order for you the drugs. Whether they order enough drugs or not, that should not be your concern because they are your seniors. That is the same thing. I think within the facility improvement fund regulation, it should be improved so that they can buy directly under supervision from the pharmaceutical companies. That is one thing. There's also what we call continuous training. It is done so nicely in Uganda, and it seems within the system it is mandatory. But in Kenya, you have to request this, you can request that, you can request that. One of the reasons why you cannot be given an opportunity to go and study out may be lack of doctors. But we can't say Uganda has trained more doctors than Kenya, because by the time you were developing, they were fighting. I expect we had a lot of doctors in Kenya than Uganda. But the only problem is that brain drain, where our doctors are moving out because of unfavorable working conditions as compared to Uganda. These are some of the things maybe are beyond our control. But what we can do, we should do. Now, we also have a mentality. There's a lot of problems in public hospitals. I think with the public hospitals, many people now fear going to public hospitals because of the mentality developed according to the services they are giving to the citizen. This one also, if we can do it, if we can change that mentality, we'll promote our hospitals. Unlike Uganda, where Ugandans are being helped, and anybody, even if you come from Kenya, you can be treated in the same way the Ugandans are being treated. But go to Kenyatta Hospital. I was once in Kenyatta Hospital when I was in the medical committee. From what I've just heard, the way the Vice Chair is expressing the attitude of Ugandans and the service delivery, it is very much away from the way the Kenyatta Hospital is doing their services. So you see, we are lagging behind because of some issues, which we can just sort within ourselves. And what worries me most, Mr. Speaker, is implementation of all these reports. We can be having very good reports, really, but if they are not implemented, it is like a man sending somebody away like a flower girl. We are doing nothing. We have to stand our ground, and it is good that now the chair of the implementation committee has accepted that she's going to wake up and deliver. I applaud her for that, but let it not just be a matter of talking in the House. We need that kind of implementation committee to follow up all our projects, because you will not be implementing them. Surely it is the executive to implement. It is you now to send and see that what we have passed here is implemented. Thank you, Mr. Speaker. We applaud the committee. I support the report. Thank you.
Honorable Benny Pete.
Mr. Speaker, a committee of Kenyan County Assembly went to Uganda for benchmarking. And in their report, they are full of praise of medical services in Uganda, giving the picture that the one in Kenya is not so impressive. Mr. Speaker, that is the reality on the ground. And we know what ails our medical services. We cannot hide. The big problem we have in Kenya is the mindset. In Kenya, when you are a medical doctor, when you are in the medical field, the mindset is you must become a billionaire. I've seen cancer center at Jaramogi Oginga Odinga Teaching and Referral Hospital being used here as a comparison. If this assembly is asked to give evidence, to give facts on the construction of cancer center in Kisumu, what will they give? Totally nothing, Mr. Speaker. And that is the truth. When was it started? What amount has it consumed? When will it be finished? And what is the balance to be consumed? We don't know all those. Mr. Speaker, it is good to go for benchmarking, to be an eye-opener to us, but when we come back, let us see the reality. It is true that Uganda was much better than Kenya in the 50s, in the 60s. And during the time of independence, they were much well organized than us. But they had the political upheavals, which Kenya has not faced. But when you look at the infrastructure development in Kenya, we are far behind, Mr. Speaker. Mr. Speaker, on medical services that we are talking about today in Kenya, we know there are no drugs in our stores. And because we are people who don't face reality, when we get a report of this kind, what we rush to? Implementation committee. What do we expect the implementation committee to do when the sectorial committee is not doing its part? Mr. Speaker, the implementation committee is only to go and ensure that the resolutions were implemented. But that is too late when the damage is already done. Let the sectoral committees take their role seriously, and then we shall help our people. Another issue, Mr. Speaker, in Kenya, because what is also being talked about here is budgeting. Go to Uganda. When there's a project to be done, on the billboard, you will see the name of the contractor, what is to be done, the total cost of the project, the time frame for the project. In Kenya, look at the billboards. We'll only see the name of the contractor. And then the last big thing they are fond of writing is AIDS. Avoid AIDS. That is the way we are in Kenya. It is good to benchmark, but let us face the reality that we may look like a failed country when we don't do our proper oversight. Like the recommendations made here, Mr. Speaker, and one, Mr. Speaker, we were advised that when a report is being compiled, it should be numbered, the pages, for each reference. Like I wanted to make a reference to chapter 5, and I will have just said the page for each reference. When you look at the recommendations from lessons learned at Mulago National Referral Hospital. Number 1 is talking about the budget. The others are also there. We know the health department takes the lion's share of the budget in this country. But are things well organized? Things are not well organized. Last year and this year, when the officials were here from the health department, they lamented that their money for recurrent expenditure, that is their O&M, they were now being forced to use part of it to pay pending bill. And that is a record in this assembly. That has disorganized the department. And these are the major issues we should raise. Why we are not performing as per, Mr. Speaker. Mr. Speaker, it is good to benchmark, but let us interrogate ourselves and see where we are. With those few remarks, Mr. Speaker, I contribute.
Looks like there is no more member want to contribute, so I think the mover can reply.
Thank you, Mr. Speaker. First of all, I'd like to appreciate the House for supporting this, for giving good sentiments on this report. I'd like to reply first to my colleague, Honorable Oiko Pete. I don't know for how long will we be crying. There has to be a time for us to find solutions. Yeah, I know you talked about the current status of health in Kenya. We cannot pretend that we are in a good position. We are not in a good position. We need to find a solution on how to improve service delivery or health service delivery to our people. So through benchmarking, I believe, through benchmarking, we are able to learn a lot from those who've done something better than us. You know, you can't be perfect. We can't all be perfect. You have to at least learn from learn something from someone at some point. So I still support this benchmarking issue because it is through benchmarking that we are able to come back home and improve on what we have. Mr. Speaker, I'd like to bring the House up to speed on our experience. I know I just mentioned a bit of it, but I remember when we arrived at Mulago National Hospital, we were welcomed. Actually, even the watchman at the gate, I think almost about half a kilometer away from the facility, knew that we were coming. And when we arrived there, the welcome was overwhelming, which we haven't experienced anywhere else. You know, the health committee has benchmarked with the Kenyatta National Hospital, and we also went to Mamalusi Hospital, where we brought the report back to this house. But we never received any kind of welcome that we received from there. So when I hear some people talking about Uganda not capable of doing better than Kenya, I don't understand where, because we have to accept that we are not doing well. We need to improve, pull up our socks. We were given a warm welcome, and just like I say that we cannot actually express everything on the document, the welcome was overwhelming. And we can't talk about the food. Actually, we ate the patient's food, which was really nice. I wish I took some photos. Although I have some photos on my phone, I'll share with some members if you want me to share. Mr. Speaker, another thing I'd like to talk about is just to emphasize on, I actually experienced treatment at Mulago National Hospital. I remember one night I had an attack, and I had to rush for treatment there. Early in the morning at about 6 a.m. And I remember I had the the deputy director's number, Mr. Kabira. And when I made that call at 6 in the morning, that I can be assisted, he was there personally. We found him at the facility. Actually, he just told us, just come to the casualty, you'll find me there. And he was there. And the service I got there, I cannot actually compare it to anywhere else that I've gone to. Even at Aga Khan Hospital, I cannot get such a service. So when you know that someone is doing something better than you are doing, then you have to appreciate that. Mr. Speaker, another issue that one of my colleagues actually mentioned is the FIF, the Facility Improvement Fund. From what I've learned and so far from our field visits, I think FIF was a very good initiative. It's just that, you know, whenever you start something new, there has to be a bit of hiccups that need to be solved. FIF was a very good initiative, and actually, if given the right capacity, I know our facilities would actually be able to function well. Because, as you just heard, that the health department actually generates the highest on-source revenue. If only that money was actually being pumped back into the department, then I'm sure that the department could be able to use that money well and offer better services on health. Mr. Speaker, I'd also like to emphasize on UCI. Or just before I go to UCI, during our visit at Mulago Hospital, I remember we visited the lab, and surprisingly, patients don't really have to look for blood replacement for them to get blood supply, which is not actually there in Kenya. You know, in Kenya, even if you're going to a private hospital and you need blood transfusion, you have to look for blood. You have to look for a donor to replace the blood. In Uganda, that is not the case. Uganda, you go for treatment, you walk into the hospital and you need blood, and it's given just like any other medicine. I think we need to emulate that. I don't know whether Ugandans have more blood than Kenyans. Maybe. At the old Mulago Hospital, which actually hosts the pediatric ward, was such a beautiful scene. And funnily enough, also they also have a morgue. You know, they have a special morgue. They don't really mix children with the other patients. They have their own special unit where they have all their facilities. They don't have to cross over to share other facilities with the other cases, which I think is also one thing that we need to emulate. I remember when you had our discussion, or when you had our leadership meeting with the executive, remember, we were proposing that Lumumba Hospital should actually be transformed into a specialized hospital. Mostly, we were actually proposing that if we can have a pediatric hospital at Lumumba Hospital, then we'll be able to offer services to that age group, more specialized services. Mr. Speaker, as I move on to the UCI, during this trip, we also learned that at Uganda Cancer Institute has one of a very unique machine. Actually, it's a machine that is not found anywhere else. That is the proton machine, which is used, which is a non-invasive way of cancer treatment. It is the latest way of cancer treatment that is replacing chemotherapy. And actually, Uganda Cancer Institute is the only facility that has it in Africa, second to the UK hospital, to the Queen Elizabeth Hospital in the UK. Mr. Speaker, from this, we actually see Uganda actually getting more people moving there to seek treatment because of the advancement in technology and in their equipment. Mr. Speaker, as I reply to this, I'd like to encourage our people to encourage the implementers on implementing our recommendations. I know some of these recommendations, usually we make very good recommendations. We take these trips, make good recommendations, but at the end of the day, some of them actually just collect dust. I'd like to propose that whenever we make these trips, if we can actually have some of the implementers or the key decision makers on implementation accompany our groups to these benchmarking visits so that they can also have the real-time experience. And as they come back, then they're able to implement some of our recommendations. Because as we talk, I know they'll read this report and they'll think that maybe we went and sat somewhere and started imagining things. I think if we have them accompany us to some of these trips, then we'll be able to make a change, just like Honorable Eiko Pete said, that we can't continue benchmarking, but at the end of the day, there's no change that is seen on the ground. Otherwise, Mr. Speaker, as I close on this, I'd like to commend the House for having supported this report. And if your office allows, because you've seen the Health Committee actually bring reports to the House, to the floor of the House. We started off with Mama Lucy Hospital, then we went to Kenyatta National Hospital, and we also did the sub-county hospitals. We are still going around, going to the grassroots and bringing reports here. And if your office could actually give us an opportunity to visit the Queen Elizabeth Hospital in the UK, then we'll be able to come back and give the real-time experience of what people outside there are experiencing on matters health. Otherwise, thank you, and I reply.
Honorable members, now that the motion and adoption of a report of Medical Services and Public Health and Sanitation Committee on the knowledge exchange exercise between the Committee of Medical Services, Public Health and Sanitation and Mulago National Referral Hospital has been presented, debated. I want to put a question. And I put that as many of the opinion that the motion and adoption of a report of Medical Services, Public Health and Sanitation Committee on the knowledge exchange exercise between the committee and Mulago National Referral Hospital be adopted. Say aye. As many of the contrary opinions say nay. The ayes have it. And the motion adoption of a report of Medical Services, Public Health and Sanitation Committee on knowledge exchange and exercise between the committee and Mulago National Referral Hospital with the recommendation therein have been adopted today, the 3rd of April 2024 at 16:55 hours. And I want to direct that the recommendations of the report therein be communicated to the relevant departments for action. Next order.
Order number 9, motion on the adoption of a report of implementation committee on the benchmarking exercise at Kilifi County Assembly by the Honorable Henrietta Abbott.
Honorable Henrietta.
Thank you, Mr. Speaker, sir. Honorable members, in my hand I have a report on benchmarking exercise with the sister committee of Kilifi County Assembly. Mr. Speaker and honorable members, the Select Committee on Implementation.
Point of order, Mr. Speaker.
What is the point of order, Honorable Sami?
There's no quorum.
The report, my friend.
Sergeant Atam, when quorum H is raised, the quorum bell as per our standing order, I want to direct that it be rung for 5 minutes. Honorable members, as the quorum is, the bell is being rung, no member should leave the house, except the whip, who may whip the other members to be in. But I also want to refer ourselves to standing order number 33-2, and direct the Sergeant Atam that whoever is ringing the bell should ring it for 8 minutes, not 5, as earlier communicated. So only the whip can go out to whip the members who are out.
I can see the deputy whip is around. Can you confirm if you have quorum?
Thank you, Mr. Speaker. Quorum is there in the House.
Honorable Henrietta, proceed.
Thank you, Mr. Speaker. Mr. Speaker and honorable members, the Select Committee on Implementation prepared its annual work plan for the financial year 2023-2024, pursuant to the provisions of the Kisumu County Standing Orders number 193 and 194-2, which mandates the House Committee to prepare programs and activities to be undertaken in each fiscal year. The committee plan details activities to be carried out, including the approved benchmarking exercise with the sister committee of Kilifi County Assembly. Following the approval by the liaison committee, the Honorable Speaker of the County Assembly of Kisumu authorized the committee to carry out the benchmarking exercise to enable the two sister committees shared experience, challenges, and borrowed best practices that can enhance service delivery in line with their respective mandates. Mr. Speaker and honorable members, the committee therefore undertook this noble exercise from 11th to 16th November 2024, during which the Committee on Implementation engaged its sister committee of Kilifi County Assembly and the following terms of reference. Number 1, committee roles. Number 2, matters of legal compliance and framework. Number 3, engagement between the Implementation Committee and Executive. Number 4, implementation of House resolutions. And number 5, resource constraints. Mr. Speaker and honorable members, this benchmarking exercise with Kilifi County Assembly proved invaluable in sharing experiences, identifying common challenges, and exploring best practices. The insights gained will significantly inform and guide the Committee on Implementation in refining strategies for more effective oversight and implementation of House resolutions. Mr. Speaker and honorable members, the report therefore encompasses detailed insights and analysis derived from the benchmarking exercise. Covering the terms of reference as mentioned before. Committee findings and observations. Committee roles. Mr. Speaker and honorable members, both the Committee on Implementation of Kisumu County Assembly and Kilifi County Assembly engaged in understanding the specific roles each committee plays within their respective assemblies and how they effectively discharge their duties. It's no doubt that the responsibilities of both committees is to oversee the implementation of resolutions passed by the Assembly at the executive arm of the county government and to ensure accountability and compliance in the utilization of public resources. Matters of legal compliance and frameworks. Mr. Speaker and honorable members, both committees committees expressed their concern about the exercise of legal constraints such as court orders obtained to restrain the assembly on implementing certain resolutions. These are certain circumstances where an officer or any interested party would resort to obtaining a court injunction to avert a resolution of the assembly. The committee also noted that some of the powers and privileges of the county assemblies have been donated to the Senate of Kenya, and therefore, in event that the officer has committed a felony and she or he is well connected politically, then the resolutions of the assembly can easily be reverted. It is therefore not easy to hold the executive accountable for non-compliance. Challenges were noted regarding the enforceability of assembly resolutions and the absence of clear mechanism to sanction county executive members for non-implementation. The engagement between the implementation committee and the executive. Mr. Speaker and honorable members, the discussion here were aimed at understanding the dynamics and mechanism that govern interactions among various entities within the county government. Both committees emphasized the importance of defining clear roles and responsibilities to avoid conflicts or overlap between the Committee of Implementation and the executive. Both counties recognized the need for synergy between different committees within the assembly or harmonize between the harmonize efforts and prevent duplicity in oversight or implementation tasks. The collaborative approach would also enhance cooperation among committee, emphasizing the importance of information sharing and joint effort in addressing assembly matters. Both committees stressed on the significant and transparent and regular communication channels between the Committee on Implementation, the executive, and the other committees to facilitate smooth operations. Implementation of House resolutions. Mr. Speaker and honorable members, both committees also raised concern on the enforcement of the House resolutions. Some of the County Executive Committee members, upon receiving a resolution from the County Assembly, resort to either ignore or delay its implementation for reasons best known to themselves. Both counties face administrative bottlenecks within their respective government structure, slowing down decision-making processes and impending swift implementation of resolutions. Inefficient interdepartmental collaboration was identified, leading to delays in the execution of resolutions and hindering seamlessness cooperation between different arms of the government. Resolutions constraints. Resource constraints, sorry. Mr. Speaker and honorable members, both committees acknowledged financial constraints as a significant challenge to empower members of the committee of the County Assembly to execute their mandate. Limited budget impacted their capacity to conduct thorough oversight and invest in technology of monitoring purposes. The issue of staffing limitations also arose, including insufficient personnel, which affected the depth and efficiency of their oversight and implementation efforts. Both committees noted that some of the departments of the executive were unable to implement a resolution due to either lack of sufficient budget allocation to the respective departments or inadequately or adequately trained qualified staff or to implement the resolutions. Both committees highlighted the importance of field visits as a means of physically verifying the status of implementation. Those visits enable first-hand assessments, validation of reports, progress, and identification of on-ground challenges. Both counties recognized logistical challenges such as resource constraints or travel limitations that might impede the frequency of effectiveness of field visits. Recommendations. Mr. Speaker and honorable members, both committees explored the following potential recommendations to mitigate some of the challenges as they execute their respective mandates. Number one, there is need for a review of the existing legal framework to identify any gap, particularly in crucial areas such as the enforcement of assembly resolutions and the imposition of sections of county executive member for non-implementation. This review will ensure that the responsibilities of committees and the assembly as a whole are taken seriously and effectively carried out. Number two, it is crucial to establish a framework for collaboration between the joint committee to facilitate ongoing sharing of best practices, thereby strengthening oversight efforts. This will promote synergy for better results and enhance delivery of services in the county. Number three, there is need to explore specialized training opportunities for committee members and the technical staff. This will empower them with knowledge, skills, and confidence to effectively carry out their mandate for improved delivery of services. Number four, to improve the monitoring of the House resolutions, implementation status, it is crucial to enhance the tracking tool. This tool will aid in assessing progress, promoting accountability, and facilitating continuous improvement. Number five, it's essential for counties to embark on developing strategies aimed at gradually increasing the percentage of county allocation through collaborative effort with the national government. This will subsequently result in increased budget allocation for committees, thereby empowering them to effectively enhance their oversight role. Number six, as a matter of priority, the executive should consider designating a liaison officer to improve coordination between the executive and the assembly. This officer's duty will include developing regular reporting schedule, establishing standardized formats for progress reports, and ensuring effective communication, regular updates, and feedback. Number 7, there is need for a clear engagement mechanism between the Select Committee on Implementation and other committees and relevant departments of the Assembly. This will enable the committee to effectively address challenges such as poor coordination, regular communication, and feedback, timely submission of both quarterly reports and resolutions of the House. Thank you, Mr. Speaker, sir. It is now my honor and privilege on behalf of the Committee of Implementation to move this motion before this House for consideration and adoption. I therefore would like to call my Deputy Chair, Honorable James Were, to second. Thank you, Mr. Speaker.
Yes, Honorable James Were.
Thank you, Mr. Speaker. Mr. Speaker, this committee on implementation got an opportunity to benchmark with the sister committee in Kilifi. Mr. Speaker, the committee went there so that they can compare notes, they can learn on the best practice on what they can come back and implement in our county, Kisumu. Mr. Speaker, we realize that we share common things. Mr. Speaker, we also realize that we have similar challenges that affects the implementation status of all the House resolutions in Kisumu and affects the implementation of projects within Kisumu County. Mr. Speaker, I want to implore on this House to ensure that we put our executive to task so that whatever is passed in this Honorable House can be implemented, and whatever the proposals that are made by our people concerning the projects that are done are also implemented. Mr. Speaker, we also realize that both the committees from both counties agreed that we need to have a monitoring team. It is important that Kisumu we have a monitoring and evaluation team, which was missing from Kilifi, but we realized that our counterpart had most of their projects implemented than what is happening in Kisumu. So, Mr. Speaker, I want to request this Honorable House. It is a strong House. Let us ensure that we support the implementation committee. Let us also partner with all the select committees so that we can put the executive to task to ensure that we get value for money, to ensure that all the House resolutions are implemented to the letter. Otherwise, I want to second the report. Thank you, Mr. Speaker.
Thank you, honorable members. The Committee on Implementation has moved a motion for adoption of a report on their benchmarking exercise with the sister committee of Kilifi County Assembly. Honorable members, before I put a question for debate, allow me to refer honorable members to page 7 of the report, the last paragraph, and it reads, The committee also noted that some of the powers and privileges of county assemblies have been donated to the Senate of Kenya, and therefore in an event that an officer has committed a felony and him or her is well connected politically, then the resolutions of the assembly can easily be reverted. It is therefore not easy to hold the executive accountable for non-compliance. Honorable members, I don't remember any section of an act that is donating any powers and privileges of county assemblies to the Senate. And I want to direct that this section of the report is expunged before we proceed with the debate. Having said that, honorable members, now I put a question that we open this report for debate. Yes, Honorable Bill Oliver.
Thank you, Speaker. Mr. Speaker, I want to appreciate the work of the Implementation Committee, chaired by one of our own from Kubura, Mheshimiwa Henrietta Bodo. Mr. Speaker, the report is giving us a clear picture of the challenges that the Implementation Committee is facing in Kisumu and also the Implementation Committee in Kilifi. Mr. Speaker, I want to support, and in my support, if you look at what they are having as recommendations, Mr. Speaker, the recommendation is that we should have a system of monitoring the resolutions of the House and how they are implemented, which is a good thing, Mr. Speaker, because as members, we pass a lot of reports from the Assembly, and without a particular system where we can also have a look into and see the progress of the implementation by the executive, then it is a challenge. Because if we want to follow all of them, I believe that will be an easy way of doing a follow-up. Another thing, Mr. Speaker, from the report, I agree that the Implementation Committee should be given enough resources, because you realize that this is a committee that interacts directly or indirectly with all the committees, because everything from every report ends there because they have to be implemented. So I think in our next budgeting, we should consider implementation so that at least it can run well, so that we don't have any other excuses of some. Then, Mr. Speaker, I'm worried again, because if you look at everything that we've passed since we started our third assembly, I don't think most of them have been implemented. So the Implementation Committee should go first and ensure that everything that we pass here as an assembly doesn't gather dust, because we are for the well-being of Kisumu County, and if they just sit somewhere and gather dust, it means all our efforts. And you heard from a member some time back, Kisumu County has very good members who have experience, members who can do a lot for this county. So all that should not gather dust. With all that, I support.
Benny Pet.
Mr. Speaker, the committee went for benchmarking, and the report is tabled before the Assembly today, which is a good way of learning. But, Mr. Speaker, on benchmarking, we go to find out the best practices, the challenges that are there, and those ones are expressed here. But what the Assembly needs to take into account and seriously value is that the committees work in collaboration. The implementation committee comes at the far end of all the exercise. Whether things were done rightly, whether things were done to completion, whether things that were supposed to be implemented, like the projects, the resolutions, have been done so. And it seems there's a lot of lamentation that the legal framework, the powers of the executive, which must be there. But what is important is the report tabled in this House that we will interrogate and make a decision. That is what is important in all this. And let members of the Assembly note that the assemblies have been taken to be weak on their oversight role. And that is why the Senate is asserting its authority, and they are succeeding in getting oversight fund. So let the Assembly pull up its socks to show the country that we are also worth the salt. That will be very crucial. And I echoed here that it is not the implementation to do everything. The sectoral committees are also there. And once the record comes here, it is a record of the House and we can refer to. Like one time, the Health Committee tabled a report of their fact-finding on our healthy facilities, what they found. That is a very good report of reference for the Assembly. And we also need to look at the audited reports that are tabled here and handled by the pick and the pack. When we go that way, we shall achieve and we shall show the country and our people that we are worth what we were elected to do. Let the implementation department not feel that they have too much work, members are bothering them, they are put on focus. The implementation committee can't do everything. A lot of work is to be done by the sectoral committee. Then the implementation committee will only come last as a last resort to give us, this was well done, this was not done properly. When there is complaint or when they take their time as a committee to also go outside and ventilate what ought to have been done. And Mr. Speaker, with this kind of arrangement and discussion, we shall be well versed on our role as members of the Assembly, and I know we shall be versed with what our role is and what we are supposed to achieve. Thank you.
Honorable Naraya.
Thank you, Mr. Speaker. Mr. Speaker, I also rise to air my views on the report moved by the chair implementation. Honorable Speaker, I exactly don't know whether to support or contribute on the negative. But Mr. Speaker, when looking at what informed the decision to benchmark, the committee is telling us that the basis was number one was to know their roles and mandate as a committee. Number two was they were to benchmark on matters of legal compliance and framework. Number three, they were going to benchmark on engagement between the implementation committee and executive. Number four, on implementation of resolutions and resource restraints. Mr. Speaker, and the committee refers to this report, to this benchmarking visit as invaluable, meaning the exchange visit was met more than they expected. It was beyond their expectation. But looking at their findings and observations, Mr. Speaker, the committee is telling us that on the other side of on the side of Kilifi government, they also found out that there was inadequate budget allocations hindering timely implementation of House resolutions. The committee also acknowledged the shared common challenges as administrative bottlenecks. And Mr. Speaker, from their findings, they didn't find anything different or anything that warranted the exchange visit. And Mr. Speaker, moving down, further down to their recommendations, their recommendation number one is to review legal framework to identify the gaps, particularly in enforcement of resolutions. And number two, they are saying that they want to establish a framework of collaboration between this committee on implementation and the other committee. Mr. Speaker, I want to believe that the county expects value for money from us as an assembly, and therefore what should be considered important worth collaborating or giving or expending our resources on is something that is worth learning from. Just as, Mr. Speaker, we've seen from a report that has just been tabled by the Deputy Chair Health, you can say that was a commendable report, and any suggestions of collaboration, Mr. Speaker, was worthwhile. And in proposing a collaboration, Mr. Speaker, with a sister county where they saw no value and found nothing new, Mr. Speaker, from what we have, I think is not worthy. And Mr. Speaker, talking as the chair implementation, I want to refer this Honorable House, Mr. Speaker, on a matter that had been tabled and discussed before this Honorable House, that is businesses pending before committees. And Mr. Speaker, I look at the Committee on Implementation and I see all reports or all works relating to their mandate as a committee that were presented before them are either pending or in progress. And Mr. Speaker, I want to just urge the committee members and committee chairs that when preparing our work plans and requesting for more resource allocations, then we should, Mr. Speaker, center on our mandate rather than benchmarkings, because, Mr. Speaker, I don't see any value that this report or this benchmarking exercise is bringing to the people of Kisumu County. Mr. Speaker, there's a number of other committees that still have their work pending, and all cry is about resource allocation. Members, I want to urge that when exercising our roles, we should give the county what its Honorable Speaker, protect me from Honorable Seth.
Honorable Seth, order.
Mr. Speaker, he has confused me, but the point is that let us concentrate on our mandate, and even in budgeting and asking for resource allocations, let us not take benchmarking reports that have no value as a basis for requesting for more allocations. Thank you, Mr. Speaker. I oppose this report.
Honorable Seth.
Honorable Speaker, going by the mood of the House and members, allow me to call the mover to reply. Thank you.
Honorable Henrietta.
Thank you, Mr. Speaker. Thank you for those who have supported my report, and thank you as well for those who have not supported it. But I want to put it clear to this House that when one is going for a benchmarking, whatever you call it, you don't go expecting to get less or more. That is why you are going there. So when we went to Kilifi, I don't think we really did know that what we are going to get is what we also have here. So that is a reply on a lighter note to Honorable Nerea. Secondly, Mr. Speaker, he has said that the report has got no value for money. And I think that is very cruel on our side. It is, we have just found, I cannot just find it, but if you go through your notes, we have recognized that we need to have a liaison chair that will be coordinating between the House and the people who are helping us, the Secretariat who are helping us draft these matters. So I think that is a new thing. So you cannot just come up and say that there is nothing new you have found here. Otherwise, thank you very much. Thank you very much, Mr. Speaker. And on the issue of resource constraints, I want to put it clear that since we started in this committee, we haven't gone anywhere. So I don't see the wrong in asking for resources, because soon we are going to start walking from one place to the other, trying to find out the implementation status of these things. How are we going to do this? So going to Kilifi was not in vain. And even being here is not in vain. We are here because we have a reason to be here. And if you want to close your eyes not to see anything good in a report, just close your eyes. Thank you, Mr. Speaker.
Honorable members, and now that the motion adoption of a report of the Implementing Committee on their benchmarking exercise with Kilifi County Assembly has been moved, seconded, and debated, I want to put a question. And I put that as many of the opinion that the motion adoption of a report of Implementation Committee on the benchmarking exercise at Kilifi County Assembly be adopted, say aye. Aye. As many of the contrary opinion say nay. The ayes have it. And the motion adoption of a report of Implementation Committee on the benchmarking exercise at Kilifi County Assembly is adopted today, the 3rd of April 2024, Wednesday the 3rd of April 2024 at 17:43 hours. And I direct that the recommendations of the report therein be put into action. Next order.
Thank you, Mr. Speaker and honorable members. There's no other business to be transacted in the order paper.
Honorable members, I want to communicate that tomorrow after plenary, the leader of majority has reminded me to invite all the elected leaders for a short meeting immediately after plenary. But I also want to communicate that we'll combine it with a small Kamkunji immediately after the plenary tomorrow. So please inform the other members that tomorrow after plenary we'll have Kamkunji, but the leader of majority also would like to meet all the elected leaders of Kisumu County Assembly. There being no any other business, the House stands adjourned until Thursday, the 4th of April 2024 at 2:30 p.m.